forehead is okay.
Một
Okay. This one is.
Ui, ăn tao ở đây cái
Maybe you can do better. Who did
ăn
this
đâu
one?
rồi?
Okay. So you have to stretch. Okay. Thumb, index.
Ôi,
Thumb,
mày cái
index finger, stretch the skin. No stretch on the tape. Okay. Okay. Next one. Stretch the skin and to apply. Okay. Close your eyes. Okay. You feel it is a little bit softer.
Sure.
Touch right side, touch left side. Yeah, yeah, you can even do like that. That's an evaluation. Which side is softer? Yeah, feel that side is a bit hard. Okay. Okay, so we're applying the tape. It's always the way. Okay, very good. Put your feet like that. Okay, correct postural position. Correct postural position. Put your feet same width as the hips. Correct. Feet parallel or Malaysian posture or correct posture. You want to go and touch the ground? No problem. Someone else? Someone who cannot touch the ground. Okay.
哎，我这边还有一个哦。
The legendary.
哎，阿文，
Feet like this, parallel. Okay, parallel. Okay. More correct. Okay. Now go down, touch the ground. That's maximum. Stop. Yeah, we don't. Okay, come up. Okay, go down, touch the tibia, where you can touch. Yeah, that's maximum.
Yes, ma'am.
Touch, touch.
Yeah, you want it.
Me, not.
Sir,
we got one more worse one.
we got what's... We got what's...
Okay, so we're going to do a lumbar application. Okay, so our objective is to apply the tape over the lumbar muscle fiber. Our objective is to apply the tape concentric or eccentric. Eccentric, not concentric, because he is already suffering with excessive concentric contraction. Rigidity, touch here. Soft or hard? Hard. Hard means muscle contraction or muscle relaxation. How do you know? When you touch, if it is hard, obviously there is muscle contraction. How do you know? You've seen the research which says that? No. But it is obvious or not obvious? Obvious. Okay, muscle contraction. Okay, more contraction on left side than right side. Okay, so our objective is to apply tape elongation. So, okay, so we need to find the intergluteus line. This is the intergluteus line. So we're going to draw a horizontal line at that point. We're going to find the spine and the extension of the spine. Okay? So we're going to divide the body in half. Then we're going to get 2 centimeters on one side, 2 centimeters on the other. 2 centimeters. And so our objective is to apply the tape over the muscle fiber, okay? Not over the spine, over the muscle fiber. And our objective is to elongate, not contract, elongate the muscle fiber, correct? Okay. So, going to decide the length of the tape. This is a standard length. If you're 160 centimeters tall and less, 25 centimeters. 25 centimeters, which is 25 small blocks or 5 big blocks, correct? 25. Between 160, 180 centimeters, 30, over 180, 35, okay? So, his length is 1, 2, 6, 30 centimeters, correct? Okay, so we're going to cut two tapes which are the same length. Exactly the same length, put one on top of another and round the corners just like that. Okay. So, number one problem in the world is lower back pain. Who wants to do a research on lower back pain in Malaysia? The tape. Okay? So let's think about a research program on students, treating 200 students with tape and with no tape. Who wants to be a part of that project? Okay? So we're going to do a research project in this university. Okay? Our objective is to, what is neuromuscular taping? It is zero tension of the tape over the skin in contraction or elongation. Elongation. So put the feet parallel, put your hands on the table, flex, 45 degrees, lumbar flexion, 45 degrees. Okay? So this is 0, this is 90, this is 45. Keep on going, flex a little bit more, stop. 45 degrees of lumbar flexion. Not a 90 degrees, 45, okay? So you feel the skin is stretched over the muscle fiber, elongation, okay? Start at that point, take off the paper, you remember, paper on paper, paper on paper, just like that, and you just lay the tape parallel to the vertebra. How much tension? 0. 0 means a little bit, or 0. 0 means 0. Definite. Okay? So you start both tapes at the same point. Okay? Okay? Just want to come around. Okay? Same point, same distance from the vertebra. Okay? 0 tension. If you start in the same point, you finish. The same point. Stick. I'm coming up. Okay. And so you see how the tape is wrinkling from the sacrum up until the dorsum. But just have a look at the wrinkles. Okay, just look at the wrinkles. Here is wrinkling, but here it is starting to wrinkle more or less. And the wrinkles are in which direction? Like this. Which means here the skin is elastic in what direction? This direction. Skin is elastic like this, not like this. Here the skin is elastic. What direction? This direction or this direction? This direction. The skin here is elastic. This direction. The skin here is elastic. This direction. Here the skin is elastic like this. Okay? Like this, like this, like this, like this, like this. Correct? Okay? In the gluteus area, the skin is elastic in what direction? This direction. Okay? This direction, this direction. Up until here. Then the skin becomes elastic again in this direction. Okay? So the skin has to follow the anatomy. Okay? The skin has to follow the functional anatomy. Okay? And so the application of the tape If you see a tape like this, good application or not very good application? Not very good, because you have to treat one area in a certain way, you treat another area different way, different way, different way. Okay. So, different segments, different applications. Okay. You want to go walking? Walking. Walk. You come back. Okay? So just look at the tape when he's walking. Okay. Left leg goes towards the front, which means the tape on the left side wrinkles more or less? Less. Left leg comes back, wrinkles? More. Wrinkles less, wrinkles more. Wrinkles less, more. Okay? More. So the tape has to be activated. We can activate the tape manually, but we're going to activate the tape through the patient moving. Okay, so we put the tape and we get the patient to walk, and then come back. Look in that direction. Okay, sit and stand 5 times. No wrinkles, more wrinkles. No wrinkles, more wrinkles. Wrinkles, more wrinkles. More wrinkles means more pushing. Pushes more. Okay, stop 5 times, yeah? So that is the protocol treatment. Okay, apply the tape, just walk around, sit and stand 5 times. Okay, you want to turn around? Yeah, put your shirt. Shy boy. Okay. Malaysian posture or correct posture? Correct posture. Okay? Good. Come up again. Go down again. Okay, a little bit better. Okay, a little bit better. Okay, so we're going to expect 5 centimeters, okay? Cool. Okay, so we're just going to do a test. Now I want you to do this application. I want you to test the flexion before and after. Okay? So if someone goes down like this, okay, you see what happens afterwards because you're going to get like this afterwards. Okay. Okay? So we're going to be using this for what sort of condition? Lumbar pain, could be herniation pain, okay, but we'll look at a different technique later on for herniation. So it's going to be lumbar pain, it's going to be a postural application, group posture. Of course, we expect that the patient feels straighter. You feel straighter? Higher? It's a little bit higher, okay, a little bit higher, better posture. So we're going to be using this for pain, postural conditions, but for the neurological condition, okay, so we have the sacral plexus, so if we have a neurological condition in the lower extremity, Parkinson's, multiple sclerosis, CP, stroke, we're going to be applying the tape to open the door or close the door. Open the door. From a neurological point of view, okay? Which means it's going to facilitate the walking process, okay? Let's do it. Do the flexion before and after. 好高兴。
我去厕所号码，厕所里头。
啊，sorry。
But it's on YouTube Live. This is what we do.
Cannot.
Yeah.
来，往这边的。
啊？不用紧，阿兵不会打我。
阿斌会打，不打。
走。来，cannot 啦，YouTube 非常。在前面一点点。你好吗？哦，下。
来。
不错嘛，还是有。
Yeah.
45 degrees Celsius.
Oh.
That's the same. Open your hand. Okay, now do the other one exactly the same. Okay.
Thank you. Bending down.
Thirty centimeters. That's under 160. Okay, so it has to be 30 centimeters. Okay, so it's going to be too short for you. So you have to cut again 30 centimeters. Yeah. 160 to 180, 30. Over 180, 35. Okay? Use this for
160.
So 1, 2, 3, 4, 5, 6. Okay, so just go like this. Got 2 steps the same. Yeah, keep it like this. Yeah. 2 centimeters and 2 centimeters. Right side, left side. Okay, next towards the front. Bring speed. Lumbar flexion. Your hands on this. Lumbar flexion. Okay. Now you get one hand like this. With the paper. So it's zero tension. Just start to the spine. Lock it with your thumb. Get the paper. Take it off. Okay. Open your hands. Open. Okay. Okay, now do the other one exactly. I'll call you in a second. Parallel, flex towards the front. To your flexion. Hold on to the table. Rest on the table. Flexion. Stomach in. Head down. Stop. Somebody has some scoliosis.
Number 2.
Okay.
Good one, good one.
Number 2 is what? What do you mean?
Number 1, wait on. Number 2 is you. Later you need to go in front.
你等一下玩啊！喂喂喂，I got question。
Go lah, go different lah. Go different lah. Right.
Cameraman. Don't push, don't push. Wow, so tall. I feel so.
Suddenly,
I feel so inferior. Guys, it's live. It's live. Yeah. Nah, come. Hello.
Okay, not the same.
They don't know that they take yours goes there. No eyes, they want to take.
Wow, le.
Habis lah, malas.
Dah sah?
Try.
Go for anyway.
No.
How is the process? Is it? Go down. Go down. Again. Wow. Wrinkle.
One 160 centimeters and below 25 centimeters. 160 to 180, 30 centimeters. 180 and above. Five.
See? Show behind. Ooh. Not bad. Blue one ah? Vincent got back pain one. Do for him. ST, come see your product. See a bit. Hah? Done lah.
Sakit. Finish baru habis.
Alamak.
After tapping.
Oh my god. Got tape or no tape? Oh. Oh, haven't or? I will wait. In process.
What?
Open rib scene. Come, show. Show behind. See improvement? Got improve ah? 哎呦，哇！拜拜，没有看到。好，
来这个，来这个，来这个。
Nana, what are you doing? Oh.
开了门吧，我开上了。This is a game, it's a... 啊？找看谁还没有粘掉它。我before 这边报啦，我能到顶报。我觉得你可以再下我了，维动比你还少，还能下很多了，真的。你看维动啊，当时先掉，你看它，当时先掉。要不然你以为我穿鞋呢แล้วหนักไอ้ขุนที่ตกที่สุด
哦，可以哦，可以。back 啊，那个脚啊。
对，不要玩。好不然成都杯。啊，可以啊。我会拍。而且我会拍粘到没有？
这个你拍下不了。
我有没有地方拍啊？全部偷了吧？
下次啊，哎，我们上公车的话做这个不用再麻烦找材料了。
不要啊，粘嘛。你要怎样？你要做粘怎样东西，我就帮你粘。
Hello guys, I would like to have your cooperation to reduce your voice volume a bit because on our right wing side we are having examination. Please lower down your volume. Thank you.
Okay, everyone come back. You just tell the people who have a number written on their shoulder to come and stand at the front here. Who has a number written on their shoulder?
If 是没有进步，很明显进步了，他们还是想要跑。
Standing.
妈的！
You have a number? You have a number? No one else has a number? Anyone more have your number? The one that I wrote a number on your shoulder. Okay. Number 4. So 4 is not the merge. Okay, so what is the problem? Come around this one. Okay. You have to look at the application. You have to decide whether it's done correctly or not correctly. Okay? Okay. We're talking about lumbar pain. Okay. We're talking about lumbar pain, so we're talking about the world's #1 problem. Okay? If you want to be a very successful physical therapist, you're going to have big results. Always, not sometimes. Okay? So it's not more or less correct. So it has to be precision and continuous applications. Okay, so what is the problem? This is pretty good. The wrinkling is pretty good because when you touch here and touch here. No, touch this and you touch this. Which is softer, here or here? Here is softer. Perfect. If the tape is softer, done correctly. Okay? Next problem is, what's the problem here? Like positive criticism, constructive criticism, not negative criticism. What's the problem?
It's not symmetrical.
Asymmetrical. Okay, so you're creating an asymmetrical stimulus for the patient, which is going to work for 24 hours a day for 3 to 7 days. So you want to do correct stimulation or incorrect? Correct. Okay? So, flexion towards the front. 45 degrees, correct? You see the vertebra? Okay, very easy. Because it is so easy, there is another problem. What is the other problem? Stretch, 2 centimeters. Okay, so stretched and not symmetrical. So in this one, you have to refund your money. If the patient pays you for incorrect application and there's not much result, then you have to pay it back. Correct? Yeah. Okay, better. Okay, thanks. Okay, so I don't remember. Yes. Okay. Okay, so there's no tension on the tape, very good. But also here, what is the problem? Symmetry. Yeah? Because here is the vertebra all the way over here. Just flex towards the front. Okay? You feel the vertebra? So? Symmetrical application. Okay, thanks. Next one. Okay, so. Okay, also here, standing position. Okay, so. Okay, everyone can look, put your thumb like this. Is it straight or not straight? It's not straight. Pisa syndrome again, Pisa. Okay, so we have to create 2 stimulus, 2 tapes stimulating the body exactly the same way constantly. Okay? And that is the added value that the tape is going to give to the patient. Postural, pain, functioning. Okay. So, Again, there's no tension applied on the tape, very good, but I was going to say, maybe you need glasses, but you already have glasses. Okay, anyway, has to be correct. Okay. Okay, so, okay, pretty much parallel, okay, but again, in the last segment, you see how the tape is going in this direction. Okay. We just check on the tension. Flex towards the front, feet correct, flexion, 45 degrees, 45 degrees, 45 degrees, stop, 45 degrees, lumbar flexion. This is pretty good. So let's just check here. Oh my God. You see, what is the distance? Okay, so this one was stretched. If the tape is stretched, concentric compression over the muscle which is already in contraction. So the result is going to be minimum. You want the patient to pay $30, $40, $50. If the patient is going to pay for the treatment, you have to guarantee results. Correct? Okay? Okay. Okay, so also here, started off okay, but what's the problem? Too close. You see here there's wrinkles, but here there's no wrinkles. Okay, so there's some problem in the application. Again, flex towards the front. Okay? You ask the patient, flex towards the front. Okay? And the patient flexes like this is flexion or extension. Okay, we want flexion. Because the patient doesn't know what flexion means. Okay, so feet parallel. Correct posture, not Penang posture. Okay, so so the first thing is to learn how to not stretch the tape. Okay, that is the most difficult thing. Strange, no? Very strange. Very simple thing. It's very difficult. You need 24 hours to learn not to stretch the tape. As soon as you learn how not to stretch the tape, everything else becomes easy. Okay, very good. Okay, so his first trial was here. Okay, go and touch the ground again. Oh, even more.
Yay!
Who did this? Who did? Who put the tape? Who put the tape? Okay, he's going to have a Porsche parked in his garage. Okay, and the other guys, you're going to have a scooter. Okay, but seriously, okay, it's a question of correct application, and we just verify. Okay, very good. Starting little bit not symmetrical. Okay, could be a little bit more symmetrical. Centering the muscle fiber. Okay. Okay, everyone else okay? Okay. Hey, you got number? Feet parallel. Okay, flexion towards the front. centering the vertebra, coming up. Perfect application. Internationally classified as perfect. Okay? Who did this? Who did it? Okay, very good. Okay, so. Okay, so we just make some space. We put the patient here.
Move your ass.
Okay, hello. My name's David. Okay,
His name is Ramalu. Mr. Ramalu. Or just call him Uncle.
Uncle.
Can Uncle? You can ask about the little brief about the case. Kamala, where's call? Okay, okay. By the time you can continue. Let's assess the case, yeah? I do not know much about the history. Uncle, the person on the road actually. Narka? Ile parada musko. Oro serma. Oro serma. Maybe 1 year old.
1 year ago?
3 years.
3 years ago.
3 years ago. So already said that. Yeah. So
Okay.
one thing is clear that the facility is gone and spasticity is set. So in the form of either flexor synergy in upper limb, and definitely you have adductors, lower limb, yeah? So you have flexion, adduction of upper limb, you can see the flexion of elbow, internal rotation, wrist flexion, and fingers are closed. It's not open. This is stage of spasticity, which remains residual. Even though he is treated, it is not treated well at the beginning stage. So this still remains. Even when you see his foot, it will be very rigid. When you try to open up, it will be very hard, especially knee and ankle and foot and toes. And that will be more in what position? Internal, external? It will be more towards external rotation. Understand? And adductors will be very tight. So that is a problem. Adductor tightness, knee stiffness, ankle stiffness, shoulder, elbow, wrist and finger. Because of this position, he is not able to maintain his posture, and even if he try to walk, he tend to fall towards the affected side. So let's see how he will realize
Okay, so again, okay. 3 years, stroke, hemorrhagic or ischemic? Ischemic stroke. Okay, so even though he has no reduction of elbow extension, so he can fully extend, he can fully extend the wrist as well, okay, but there is no function. You squeeze my hand,
நல்லா பிடிச்சிக்கோங்க நல்லா ஹார்ட் கிரீப் இந்த கை இருக்குல்ல இந்த கையில் எப்படி பிடிங்க நல்லா பிடிக்க முடியுமா இப்படி பிடிங்க அந்த மாதிரி எங்கே பிடிங்க முடியாது.
Okay, so there is no response, okay, in the contraction or relaxation. Okay, but here's the... Has pain? You have pain? Not bad. Okay, he has pain in the maximum range of movement, but okay, we can accept that. Okay. Okay, so we have most probably subluxation of the shoulder joint and pain. Pain here. Pain in. Okay, but he seems to have had very good rehabilitation because the spasticity is limited. Okay, very limited spasticity, but there is no function. So in a stroke patient, okay, he has pain here and pain in the shoulder. Okay, so we're going to do an application on the shoulder, so to reduce the pain. we're going to apply the tape mostly on the neck. So the first application for a stroke patient is to get as close to the central nervous system as possible. So he had an ischemic stroke. Ischemic. Okay? So in the acute phase, okay, it has reduced blood circulation, okay, to the certain segments of the cerebral cortex, okay, creating the, okay, obviously the disability. So, in the post-acute phase, what is our objective? Our objective is to increase blood circulation or reduce blood circulation to the central nervous. Increase, okay? So you feel all stroke patients, you feel the neck, and the neck is going to be soft or hard? Very hard, okay? So even in this functional, more functional treatment that we want to do, we have to start on the neck area, okay? This is fundamental for the upper as well as the lower extremity, okay? So, you see the patient himself, he does the rehabilitation, okay, counteracts the, okay, spasticity. Even if I do like this, I have pain, yeah? Be careful, sometimes patients can over-mobilize themselves, creating, okay, trauma, creating stress to various joints, okay? Okay, so, because he has no active functioning of the hand and 3 years, so our objectives are going to be a little bit different. Our objectives are to maintain blood circulation, maintain drainage to the limb, and to counteract the compression in the joints, as Singh was just saying, and to counteract the spasticity, okay? So, one side, the other side. Which side is going to be cooler? You expect this side to be cooler, okay? Okay, so. You take a shot. Please. Okay.
Huh?
What?
Say, olden days he used to be a bodybuilder.
What's your name? You want to say your name?
Ramulu.
No. No? You can't say your name? Can you say number 1?
One neck.
Or name?
Render.
Number 2? Okay, just count to 3. Number 1, 2, and 3. Okay, go.
Uncle, just say 1, 2, 3. 1, 1, 1, 1.
Yeah, just try.
Okay, just
Okay.
Okay, 1. Follow. 1. And the 2. Only in Tamil.
Yeah, you can say in Tamil. Okay, 1, 2, and 3 in Tamil.
One, render.
Okay, very good. Okay, because we're going to also apply a tape over the larynx. Okay? So first we're going to do our standard occipital application, okay? Because he is an adult male, okay, certain muscle tightness. What is the width of the tape? The width of the tape is 1.25. And that is the maximum width of the tape. Okay, so objectives in rehabilitation. Okay. First, you have to have the diagnosis, create an evaluation, then the objective. Yeah. Okay. Then you decide on what you want to apply. Okay. So we just work on. We just see the shoulder because the hand is pretty much has a pretty good mobility. Okay. So you have pain. Starting pain at this point. Pain.
இப்போ வலிக்குதா இப்போ வலிக்குதா
Has pain in the
Valida?
biceps muscle.
வலிக்குதா
Ah.
yes
Okay. Okay. Has pain. Okay.
Okay, we'll
Okay.
go on.
But let's just look at the shoulder joint. Okay. So this is his range of movement. Okay. So he's starting to get some pain at this point. Okay. You can see in his face, and you can feel under your hands. Okay. Lateral. This is a limitation of his movement. Okay. You can feel. Okay. Okay. So we're just going to apply the tape on the neck. You see what happens. Okay. Okay. So. Come towards the ground. Put your head down. Okay, fundamental that the muscle is extended in a symmetrical way. Okay, so it's not like this. Okay. Coming down. Okay, so we want to try and keep the shoulders as correct as possible. Okay. Okay, correcting the alignment, and then, if possible, stretch the skin up. Stretch the skin up. Again, stretching the skin up. Yeah, just keep like that. Okay, so what is the distance between one and another? 0.5 centimeter. Okay, just keep down. Okay, very good. Okay, so very different to the pediatric patient before, okay? Okay, very difficult. Before, like that. Okay, very good. And coming up. Okay, so you just need to look at the posture, just observe as we go on. Okay, we're going to activate the tape. Put your hand on the head, and you're just going to push and release, push and release, push and release, push and release. In this way. We have the vertebra down the middle, okay, and so we're working on the brachial plexus. Brachial plexus is going to control the mobility and the pain of the upper extremity, okay, and the function. If we are covering C2, okay, to C5, we're covering the cervical plexus, which we're also going to influence, okay, the larynx. Okay, so just like this. Okay, just bring your head up. Okay. Okay, so just like this. Okay. Okay. Okay, so you're just going to pain underneath. Okay? But what you feel is that his limitation of the movement is higher. It's higher. Okay? Let's just go to the side here. What do you notice? The range of movement is increased before you start to feel the tension. I feel the tension, okay? I think the pain is coming in later on, yeah? Okay? Not doing that? What was the movement you did before? With the pain? No? This one?
Release that. Getting there. Release.
Release. Okay, but look at this tightness here. What do you notice when I do a movement? It is easier or more difficult? Seems as though it is easier, yeah? Okay? And I'm not even putting the tape on the muscle fiber locally. It is proximal, okay? There was a very slight limitation in the last movement. Okay, so. Pain here. Yeah, okay. Okay, so if we have pain, let's cut into 8 millimeters. 8 millimeters, so cut into 1 meter, 2, 3. Okay. And then we're going to do a technique over the shoulder, which is a standard application for subluxation. Scissors. Yes. Expert. Expert. Okay, so this is going to be a technique which is called a fan technique. You okay? You want to count to 1, 2, and 3? Okay. Okay, so this is a fan technique which is going to be cut into 5 strips. Okay, just like that. Okay, so to cut a fan like this, you need 40 seconds. Okay. Everything okay? Okay, so our objectives can be, okay, for a stroke patient, obviously, okay, pain is number 1 symptom, okay, because if we're going to be working on quality of life issues, the patient who has pain obviously has difficult life quality. So pain we always have to treat. And so for us, pain is very easy to treat. What do we have to do? Compression or decompression over a painful site? Decompression. Decompression. So the origin of the pain or the symptom of the pain. Anyway, we have to apply a tape using wide tape or narrow tape. Tape has to be narrow. Okay, so this is a fan technique. It's a double fan technique, which is just like that, okay? So we're going to be using this over the shoulder joint, okay? So just notice his posture. His posture is like this, correct? subluxation you feel here, okay, it is approximately 2 centimeters, okay. The joint is elongation of the joint, but at the same time, we need to increase the blood circulation to the brachial plexus. The brachial plexus has an anterior aspect and posterior aspect, okay. So, this is a standard application for stroke management. So physiological range of movement is abduction, and abduction 90 degrees and flexion with the tips of the fingers on the opposite shoulder. So, okay, just like this. Okay, so it's not maximum range, physiological range. Okay, physiological range. So we're going to be applying the tape from the superior medial corner of the scapula. Okay. Superior medial corner of the scapula. We're going to be applying the tape, which is going to cover the shoulder joint and the brachial plexus. Okay, so the first one goes down to the posterior corner of the armpit. Second one, okay, it's going to follow the triceps. Third one, like this. Okay, so the tape is applied over the skin stretched. Here the skin is stretched, but here the skin is stretched or not stretched? Not stretched, so we have to lower to 45 degrees. Yeah, just like that. Okay, stop. Okay. Then we're going to get the fifth strip. We're going to go below, posterior to the clavicular acromion. And then this one here is going to go over the spine of the scapula. And in the deltoid, medial deltoid. So we will be activating the tape in this way. Okay, so we're going to be activating the tape by creating the wrinkle and no wrinkle. Okay, so consequently we want to encourage blood circulation to the shoulder joint, muscle fiber. He has reduced muscle tone. How come he has reduced muscle tone? No activation plus less blood. So we're going to be activating it like this. Okay. Okay. Okay, your base. Go to the shoulder. Okay, just look on the other side. Look over that side. Okay. Armpit corner on the biceps. Okay, brachial biceps. Second. So the tape cut into 1 centimeter is going to be working more superficially or deep? Superficially. It's going to encourage drainage. We expect the patient's hand to be more swollen or less swollen than the other one? More swollen, and so we want to encourage drainage of the limb, blood circulation to the limb. Because after 3 years, we expect limited functioning is going to be recovered. Okay, relax. Just relax. Sit down. Okay, so it is slightly more complicated application than the neck one. Okay, so our objective is pectoral muscle, biceps muscle, deltoid muscle, triceps muscle, supraspinatus, supraspinatus, posterior deltoid, medial deltoid, okay? Shoulder is more complex. Knee is easy. Ankle is easy. More muscle fiber related to shoulder functioning. Okay, so if we're just working on range, simple range of movement, pain, a little bit. Okay. Okay, so range of movement. Okay. Much less. Okay, you just come here, lateral. Okay. Okay, range of movement has very quickly increased with no pain. Okay, external rotation of the wrist is very fluid. Now it's very fluid. Okay. He says he has pain here, yeah? Yeah. So with the you hold like this, hold, don't move. So if the pectoralis is tight, what do you do on the pectoralis? Compression or decompression? No? We need a tape which is only decompression. So also here we're going to cut a tape which is 1.25. Okay. Okay, so inferior border of the greater pectoralis, so we need to stretch the muscle, okay, and to apply the tape in decompression, okay, so this is the maximum range of movement, and so what do? Stretch the tape or stretch the skin? Stretch the skin. Inferior border, okay. Okay, next one. Okay, stretch the skin. So you see what I'm doing? I'm filling in the space, applying the tape in decompression technique where the patient has the pain. Stretch the skin in what direction? This direction, or towards the muscle fiber, okay, just like that, towards the shoulder, yeah? Okay, so, that's the patient, okay. Goes into this position. Okay, we're going to activate the tape, okay? So we just see what happens, okay? Okay, so again, remember, we expect that pain to be reduced. Okay? Any sort of painful point, we can apply the tape in decompression methodology. Okay. So, okay, just look towards the front. Towards the front. Okay. You know there's something going on with his posture? Huh? Huh? Is he getting worse than before? Because before he was pretty much like this. What's happening? The shoulder coming up? How come the shoulder is coming up? The tape is pulling or pushing? Pulling or pushing? The tape with wrinkles is pushing or pulling? Pushing, yeah? Eccentric. But his body is responding in... How come? How come? Okay. Okay, let's just go on to the dorsal part of the wrist. You want to ask?
வேண்டாமா இந்த முடி எடுக்க வேண்டாமா இந்த முடி எடுக்கலாமா கொஞ்சம் எடுக்கலாமா ப்ராப்ளம் இல்லையா உங்களுக்கு
No.
ஓகே ஜஸ்ட் ட்ரை
You want to cut here? Okay. Okay.
இல்லைன்னா அந்த அடிக்கும் போது கொஞ்சம் வலி எடுக்கலாம் காலில் போடுவோம்
Okay. You want to put on
Get a chair for you, please. It's standing. Please get a chair.
Okay, just hold the hand like this. Hold the hand like this. Just like this, no problem. Yeah, just yeah, just get up.
A bit only. Thumb extension and here. Okay, so thumb extension, okay, like this, not like this, like this. Application 0%, anterior or towards the epicondyle, lateral epicondyle is your direction. Okay. So when you release, now you release, and you see the tape is wrinkling. Okay. Now come back like this. Yeah, like this. Yeah. Stretching the skin. Okay. Okay. So, in an neutral position, you see, now the hand is, the tape on the hand is wrinkling, okay? We're applying the tape like this because the patient says he has pain here. So we're going to be applying the tape to reduce the pain, okay? That is the objective. So, activation of the tape, okay. Okay, okay? Okay, next application, we're going to go over the larynx, okay? So the larynx, we cut the tape for an adult, which is 8 millimeters. So it's going to be 8 millimeters, 6 millimeters, or 5 millimeters is the range of width. So we're going to be applying the tape to reduce the compression. When your head is in a flexed position, you have more compression or less compression on your larynx? More compression, okay? So consequently, on the vocal cords underneath, okay, there's going to be more restriction. So we have a stroke patient, we have difficulty in the phonetic coordination of the vocal cords. So what we can do is to apply a tape which is going to dilate and increase the oxygenation through the vocal cords, and to see whether this is going to assist him in creating a sound. Okay? So just bring up your head like this. So we need to stretch the skin up and not stretch the skin down. Not stretch the tape. Okay? So the first one has to be centering, okay, the sternum. So from the center of the chin going right down the middle of the larynx, okay, and so you see how it's going. Okay, so applications in speech therapy, okay, or on the voice or on swallowing for stroke patients is an application that we're going to be using very quickly, okay. So for him, 3 days after the stroke, this is an application that we usually apply. So stretching the skin up. Okay, and so the last one is going to be on the external border of the larynx. Okay, just feel like that. Okay, and so that is the last strip. Stretching up and not stretching the tape. Okay, so anterior and posterior to the neck is obviously a combination that we're going to be using quite often. Okay, so it is the occipital application or the neck spinal application. Okay, I just cut this shorter because we already have one tape here. If you put one tape on top of another, what's going to happen? Compression or decompression? Compression. Okay, so the tape is not going to be one on top. This is a double fan technique. It is a particular application, okay, but it is not one tape like this. So we're going to activate the tape with the head slightly in flexion and pushing the tape up. Okay? Just like that. Okay. Prepared. This is an application for swallowing disorders, phonetic disorders, head postural disorders. Okay. The occipital application. Okay, I didn't say before, we're going to be using it for various pathologies, which is neck pain, neck postural problems, so it is flexion or hyperextension, central nervous system trauma, brachial plexus, the roots of the brachial plexus which have been traumatized through pulling of the arm or excessive elongation of the neck. Okay, so okay. So this is a typical application for a stroke patient. Okay, upper extremity, neck, posterior, double fan on the shoulder, extensors, flexors of the hand, which is similar to what we did to the child before. Okay, okay. Everything okay? Okay. At this point, let's see. Okay, because we've already spent more than half an hour on the patient tends to get tired. Okay, so the reasoning is that we apply one sort of application, and then the patient comes back the day after, and then we apply other applications on the lower extremity. Okay, but before we finish, I want to apply the tape on the lower back area. Okay, which is going to assist in his balancing and his walking capacity. Okay, so let's do it in a sitting position. Okay, what's the length of the tape? What's the length of the tape? What's his size? What's the length? 30 centimeters, okay. 30 centimeters. 2 strips? Exactly the same. Okay. So we're going to apply it in a standing position. No. We're going to apply it in a sitting position. Okay. So, okay. The patient is just going to put. We want to create more. Relax your shoulder. Yeah. Okay. Just coming towards the front. A little bit more. Okay. So applying in a sitting position. Okay. Okay, so when you apply it in a sitting position, you have to stretch the skin down and not stretch the tape. Okay? So when he's coming back, you'll see. Okay, you see that the tape is wrinkling. You see? Maybe not. Okay. Okay? So, okay. So why do we apply on the lower back? Sitting postural objective. Sitting postural objective. Okay? Breathing objective. So if he has a more correct sitting posture, then he is going to oxygenate better. He's going to breathe better. We're going to be using on the lower back for the sacral plexus, the organ, to encourage correct balancing and correct walking. Okay. Okay. The rigidity. Sorry. Okay, so here we need to apply the Achilles tendon. No break. No break yet. No break. Okay, everyone no, that's okay. Just do it. Okay. Okay, so we have an ankle which has good mobility or good rigidity? Good rigidity. Okay, so there's lots of rigidity. The Achilles tendon is going to be tight. Okay. Also, the extensors is going to be tight. Okay, so of course the patient has pain. He says he has pain. He has difficulty in the movement. Okay, so even you see in this position. Okay, this position like this. Okay, you do some movement. Okay, the whole muscle chain, whole skeletal chain is moving. Okay, see the knee coming up and down, and also the hip is working. So obviously the adductor muscle is tight. Okay, anterior posterior gastrocnemius is tight. Anterior tibialis is tight in extension. not tight in contraction, okay? Extended. So the muscle fiber is very tight. When you extend the muscle becomes very elongated and its diameter becomes smaller. So it's more compressed. So our objective here, we want to increase the mobility. So we just work like this and we see what happens, okay? So we have the skin which is pretty dry. Did you put talc powder? They put talc? No. Okay, so it's just dry skin. Okay, so lots of rigidity. So we need to put into plantar flexion and to apply the tape, zero tension. Just like, okay, so when it comes up, sees how the tape is working, okay? Next one. Okay, down, slight inversion, so stretching the skin over the tendon in elongation. Okay, so we're going to do it in 2 segments, just like this. If you do a bridge, compression or decompression? Compression. So it's not like that. You have to just let the tape fall. Okay, just like that. Okay, and flexion. Increase the inversion. Okay, so, okay, more in inversion, okay, applying the tape, maintain the stretch as you stick, okay. This is all standard methodology, okay, which means the difference between a tape which is compression or a tape which is decompression, okay. If someone says, I do decompression taping, and they stretch the tape, schizophrenic. Yeah? Okay, so the methodology has to follow the objective, yeah? No tension. Okay, no tension. Okay, so when he comes, okay. Even though we're not working on the posterior muscle chain, you can see, okay, that the ankle is easier to move or more rigid. You see in hers, easier to move, yeah? Okay, which means the positioning of the foot is also going to be easier, okay? So, let's keep on going. Is the green tape already cut? No, not yet. Okay, so now we're going over the Achilles tendon. We're just going to do a short treatment, okay? Which means we're just going to get up to the junction, tendon muscle junction of the gastrocnemius, okay? So, again here, we're going to apply the tape over the heel. So again, we need to put the foot into dorsal flexion or plantar flexion. Dorsal flexion, okay, just like this. And so consequently, we're going to be applying the tape with zero tension and zero tension, okay? Zero tension. So when it comes down, okay, you see like that, the tape is working, wrinkling. We already know that the tape wrinkles is eccentric, okay? eccentric with the movement is going to create dilation. Okay? Okay, so again, we need to activate in this way. Okay. So with these movements, what do you see with the knee? The knee is still moving, but same or less. Seems as though it is compensing less. Okay. Okay, knee rigidity, same way here. Can you pass me the tape and pair scissors? Yeah. Okay. So we're going to do a single fan cut. Yeah, so this is going to be approximately 30 centimeters. There are various applications, okay? There's usually a double fan technique anterior to the knee, but we're going to be doing today a single fan because of the dimension of the knee. Because the knee is not swollen, but the knee is. Why are we treating the knee? Because Singh was saying before, because the knee is going to be hypermobility or rigidity? Rigidity, okay, so. Okay, so, range of movement, physiological range of movement. Physiological range of movement, if the knee is 70 degrees, 90 degrees, 110 degrees, 140, 160, 160 degrees, this is physiological range or maximum range? Maximum. Okay, so we're going to do it at 110 degrees. Okay, so just hold these toes like this. Okay, so we need to create a correct alignment of the hips, knee, and the foot. Okay. So the first one. His skin is pretty dry. How come his skin is dry? Okay. Because reduced blood circulation. Reduced blood circulation because of reduced mobility. Yeah. Okay, lateral border of the patella. Medial border of the patella. Okay, and this one goes in the middle of the patella. Okay, so again here, so we extend. Okay, so just so you see his knee is now compensing the movement more or less?
Less.
Okay, so, okay, it is true, adductor muscle. Okay, we can treat the adductor muscle. We can treat all the hamstrings. We can treat the gastrocnemius, okay? We can treat the quadriceps. We can treat many, many things because the patient in this condition, what muscle is not influenced by his condition? It's all influenced. So it depends upon your primary objective, your secondary objective, okay? So always follow the pain. If a patient says has pain here, you need to treat first the pain. Okay, and then keep on going. Okay, so okay, so I think we should finish at this point. Okay, so we expect that his foot to be in a more correct position. Okay? Okay now? Okay. Thanks. I'll put this one. Oops. Okay. Okay? Okay. Okay, so we've covered a pretty big surface area of his body today. Okay, so, okay. So, is there someone from the family here? No. Ah, you're the family. Yeah, okay, so try and say to keep the tape on for as long as possible, okay? 3, 4, even 7 days if possible, and then it has to be reapplied. Okay? Okay. So just see what happens if there's some modification of voice. Maybe not today, but tomorrow. Okay. All the best.
Bye bye, uncle.
Thank you, Uncle. Guys, you guys can have your break. Please be here in another 20 minutes. Okay?